how do we help someone who is got a lot of lifestyle challenges, such as a bit of obesity, smoking, maybe not sleeping well. We'd be extremely naive to believe a little bit of shoulder exercise and a little bit of manual therapy is going to make any difference in the presence of someone who's doing their exercises with a cigarette and some fast food and not sleeping well. We have to start to realise that effect size of exercise and manual therapy is small. And what we need to start thinking about is how can we make our effect size larger.
Today on Hands On, Hands Off, we're joined by Dr. Jeremy Lewis, an internationally renowned expert in musculoskeletal research and complex shoulder problems. With dual roles as a clinician and a professor, Jeremy combines decades of practical experience with groundbreaking research that has influenced shoulder rehabilitation worldwide. He's passionate about expanding the way we approach shoulder pain, advocating for a holistic view that looks beyond traditional physical therapy to lifestyle factors like sleep, stress, and physical activity. In today's conversation, we go into Jeremy's vision for evolving physical therapy to be supportive and a comprehensive care, empowering patients in new and meaningful ways. Don't move. This is Hands On, Hands Off. Jeremy, thanks so much for the time.
My pleasure. Thank you for having me.
Standing in the back of the room during your talk a few moments ago, and I listened to the presenter, right? And you're someone who talks, so I didn't really need to watch you because you're someone who does it well and does it often. I watched the audience to see what you're doing and how they react. And the moment you put up those two videos, it was Thailand, I think, on the right. I forget where the one on the left was, and they were using hammer and chisel. And I love when people have a visceral reaction to what you're showing them when they realize that they've just learned something or they've drawn a connection between those two. Paint the picture, explain the context. What were those videos? What were you trying to show with that particular idea, that concept?
I guess what I was trying to get across in the 15 minutes was that I spent a lot of my early part of my career trying to be the best fix-it physical therapist in the entire world. It was my aim. So I did absolutely every fix-it course you could do. Manual therapy, multiple manual therapy courses from all the different schools, trigger point courses, acupressure courses, acupuncture courses, etc. And I was trying to get across in that short talk two events that happened in my life that made me challenge what I believed. And the first one was teaching in Iceland, where I was teaching in one room and somebody else was teaching in another room, and that teacher was doing a hands-on technique, but I couldn't work out just from observation what it was. And then I had this realization that we're all doing the same technique, but we're applying it with a different viewpoint, philosophy. But it's just the touch. And then the other thing I was saying is I was building a garden shed in 2023 and I fell off the roof, my mistake, and no one was giving me any sympathy except my 3-year-old granddaughter who thinks she's a doctor because her mum and her dad are doctors, and she walks around always with a plastic stethoscope, and she put a plastic stethoscope on my knee, which was agony for 3 months. I was walking around with a walking stick, and she diagnosed me as having an ouchie, and to treat me she rubbed my knee, and I just thought, wow, at the age of 3 it's already in her DNA. That if you've got something that's sore, you apply a touch therapy treatment to it. And then wherever you go, what the video on the left was Dubai, where a person was using a piece of metal to apply manual therapy. The other video was from Thailand, where people was using wooden hammers to apply manual therapy. There was a video from America. And I think what we've done, it seems to me that touch is a really important intervention, and there's evidence for its short-term benefit, but I think what's happened around the world is everybody's come up with a different philosophy why we're touching, and the truth is I think it's all the same thing, and we know that it has a short-term benefit. It doesn't seem to have long-term benefit, and it shouldn't be provided in isolation. And that's, I guess, was sort of the flavour of my talk, to suggest to people it's time for us maybe to reframe what we think manual therapy is. And some people will probably think it's the devil's work, that talk, and other people might think there's something in it.
How would you explain it to someone who's maybe new in their career, or maybe in the middle of their career, and they've treated this way because of a philosophy. How do you explain to someone that maybe it's okay to let go of a belief? Because sometimes people's identities are centered around a belief. And we like to say we're logical beings. I've read psychology and said we're actually emotional beings, and we build a story about logic to justify our emotions so we don't feel like emotional beings. But what would you say to a clinician who's like, I don't know what to believe, or I don't know how to justify this anymore?
I'm that person.
Yeah.
I'm actually the person you've just described. I honestly spent the first 5-10 years of my career trying to be that person and believe. And then I guess I got to the point when I'd done trigger point courses and acupressure courses, acupuncture courses, and manual therapy joint courses. I was saying to myself, well, actually, what treatment do I apply first? Do I do the joint first? Do I do the soft tissue first? And then the realization happened with those two events I've just described, but I guess it was an organic change. And I realized that actually, if what I'm thinking I'm doing is actually the same thing, but today I'm telling myself it's a joint, and 10 minutes later I'm telling myself it's a muscle, but I'm actually doing more or less the same thing. And if we look carefully across research, which I think for me guides me to some extent, if you look across all the manual therapy professions, osteopathy, chiropractic, physical therapy, none of us can find the tissues that we say we're finding and teaching students, and none of us really know what we're doing with our hands. And that was my journey, and I guess I'd just share my journey with anybody else who's interested in listening to it, if it's any value to them. And I truly think we've got to stop telling patients that you've got a stiff joint, you've got a trigger point that needs to be deactivated, a blocked meridian, or whatever we're telling people. These are just touch therapies that, when added to other things such as exercise, education, really important lifestyle behavioural change, which is something I think we're really missing in our clinical practice. When we add them to it, it provides a short-term benefit, which is wonderful for some people to help them move a little bit more easily, but it's not the long-term fix-it that people often believe. And the debate that is happening in social media, especially hands-on, hands-off, is just such a ridiculous waste of energy. Of course, have hands-on, but maybe we have to reframe what hands-on is and be honest about its ability to affect. And the debate we should be having, in my opinion, is how do we incorporate the much more important stuff? How do we get people to sleep better, eat better, reduce their stress, stop smoking, lose weight if that's necessary? Because it's those things that are ultimately much more important than this debate about hands-on, hands-off, in my opinion. And just hands-on, absolutely, you don't have to do it, but don't create untrue philosophies about it.
Yeah, that's the issue that I have coming from a background in communications, is when you start to make claims that you can't prove or not to be true. That's what snake oil, right? That's when we said we used to sell that thing. I like how you highlight the debates that we should be having, and I think we know that, but some people do get stuck on these philosophies, and that's what I took away from your short talk a moment ago. What do you like about conferences like this? This isn't the biggest, right? But people have said that they like certain things about a conference of this size with this group.
In all honesty, a secret just between you and me, I've sort of given up on conferences for a whole lot of reasons, but this one has rekindled my interest. This is an exceptional conference with truly exceptional people. I had inappropriate preconceptions before I came, but people here have been so humble, so receptive to other people's opinions. I haven't come across anyone with a huge ego, which is wonderful at a conference.
Me, but keep going.
Well, I'm crossing my fingers here, which protects me from lying. But honestly, it's been truly, from the president to everybody else, from Megan to Chad, all the people I've met have just been truly lovely people, inspirational people. And I haven't yet come across a big ego until this moment.
Yeah, sorry to ruin that. You've got to get somewhere, so we're going to make this a little shorter than usual, unfortunately. Maybe we'll connect online. But what we do at the wrap-up of every episode, we call it the parting shot. Is there an idea, a concept, just something you'd want to leave with the audience of therapists that listen to this as we wrap up?
Yeah, I guess there's 100 things.
Yeah.
The first thing that comes to mind is that I think if we look carefully at the research evidence, that we should be very proud that we're not offering second best care. I think the fact that when we look at all the elective surgery for the shoulder, which is my area of interest, the elective surgery that's going to be happening across this country next week, most of it doesn't outperform placebo, and none of it outperforms rehabilitation for elective non-traumatic presentations. And we should be very proud of that, because it's our profession contributing to healthcare sustainability. Our competition, of course, is not with another profession. Our competition is with ourselves, and how can we do what we're doing better. And I guess the talk on manual therapy was to sort of say yes, but put it in perspective. The talk yesterday was more about how do we help someone who is got a lot of lifestyle challenges, such as a bit of obesity, smoking, maybe not sleeping well. We'd be extremely naive to believe a little bit of shoulder exercise and a little bit of manual therapy is going to make any difference in the presence of someone who's doing their exercises with a cigarette and some fast food and not sleeping well. We have to start to realise that the effect size of exercise and manual therapy is small. And what we need to start thinking about is how can we make our effect size larger? How can we improve the quality of life, help restore that individual back to meaningful activities that make their life meaningful? And I think, final parting shot, is we have to start embracing other components of health and make it part of our scope of practice, such as sensitively assessing sleep, smoking, nutrition, and incorporate that by yourself if you've been trained to do it, or with other healthcare professionals to really make a change to the lives of people from the communities we're serving.
Love that. Jeremy, thanks so much for stopping by the podcast.
Thank you very much for having me.